Good afternoon, Ochuka.
Good afternoon, man. How are you doing?
Yeah, I'm doing good. How about you?
I'm also doing okay.
Karibu kwenye show.
Nashukuru sana.
Today we're privileged to talk about depression.
Yeah,
And we were talking to your brother, Omondi Oron.
nashukuru. That's a good topic, and I'm very sure a lot of people would find it really resourceful.
Yeah.
Yeah.
So basically, what is depression according to you?
One thing about depression, it's really hard to describe or define.
Mm-hmm.
All right, but the scientific version is ikiwa mtu amekuwa in a place of sadness and sorrow for a longer time, a longer period, that what they usually do in their normal life is affected. All right? And you find that when somebody says, I am depressed, and then you ask them, tell me about it, their language usually becomes either metaphorical or full of imagery. And that is why somebody like Rumi is a poet from the Persian. He's a Persian poet. Depression is like a night of the soul. So you realize that depression does not only affect the mind, it affects the physical body. That means how you think and behave, like the physical manifestation of it. You might lose interest in life. You might not want to eat. You might not want to even clean yourself. You might lose interest in the things that bring you food on the table, like going to work and all that. And then this night of the soul, it means that now we have transcended beyond the body. We are thinking things about like metaphysical, how you think about your existence. You tend to imagine that your existence in this life does not matter. It is not worthy. And then another aspect of depression is persistent sorrow. It's not just sorrow. It's not just sadness. People get sad all the time. It's called stress. People get to lose interest all the time. Maybe umetoka wera, umeingia mtaani, you feel a bit low. Maybe you shower, you take some meal, and then you feel good. Okay, that is not depression. Depression is persistent. Persistent means imekuwa extended over a period of time. All right. So this sorrow affects how you feel and think and behave, and additionally, it creates an obstacle in how you physically manifest your life. And that is why somebody can be so depressed to an extent they're bedridden or they are admitted in a hospital, all right? Or the illness starts to manifest in the body. You get the point, yes. So that is my understanding of depression.
So basically, Omondi Oronyi was into depression. How did you get to know that Omondi Oronyi is depressed?
First of all, my brother is a bit like I would say he has a way of defining his life privately, and when the one that he presents to the public, to other people, and that makes him guarded. That makes him have a lot high walls, I can say. Somebody who has high walls, you cannot actually see through him very easily. When you're with him in public, you might see he's laughing and enjoying life and all that, but when he goes to his own private space, he's experiencing his own moods from the one that he was presenting to the public. But the good thing is I've known my brother for a long time, and the thing that I always like is I'm not a very intrusive person. Okay, he's my brother, but I still would not want to intrude into his private space. So I always give him time so that when he feels ready, he can tell me, bro, this is what is happening to me. I feel this way. It took me a longer time to also realize that he was, fighting bipolar disorder. And these are things that, because I'm a very keen person, I'm very keen to details. I noticed them, but I didn't want to barge into his space. I wanted to give him that time so that he can be able to reach me out. Because the other thing about depression is when somebody is depressed and then you corner them, all right? Either you will not get the facts of what he is suffering from, or he will lie to you. Because he is my brother, and I don't think he would want me to get worried about his situation. And also at that point of time, I was also sickling, So there is this careful balance of trying to, see the situation so that it doesn't, bother other people that are around your life. But eventually, mostly I can also say that I used to see it mostly in his songs, in his tracks. You know, when he reached out to me that we should record, I was also writing very. Those days I used to be very hidden. My poetry was very hidden. It was very encrypted. And when he reached out to me that we should record some of those tracks, I felt somebody also understood me. And for somebody to understand me, it means they sort of either have an aspect of me in themselves. They also they see me in themselves, or they understand what it is to write such lyrics without people knowing what exactly you are trying to express.
Exactly.
Yes, so I think when he first came up was during when we were talking about one of our first albums. It's called Meeting the Eclipse, and we were talking about the whole process of creating it, what it meant to us, and that is the point where somebody comes and tell you, by the way, this is what is happening to me. These are some of the things that I find challenging in life, and yeah, that is the moment I got to know explicitly that he is suffering from bipolar disorder.
Basically, I'll ask you the same question I asked him.
Yeah.
What are you doing to make sure that no one else falls into depression?
Well, I'm doing a lot of things. One that I do almost every other day is I'm using my social media platform to advocate as an advocacy tool for the mental health awareness and campaign. That is one. Two, I'm also a member of three organizations. Huh? They do mental health awareness and advocacy in youth, but most particularly in patients, especially cancer survivors. Like I'm very sure you might have already known, cancer has a way of affecting the patient mental health. All right, so we use these organizations to champion for advocacy, better understanding. We use group therapy and meetings, and we also distribute resources and materials that could help these people cope with their daily life. All right. Also, I'm also a life coach. I can say I'm not um, uh, clinically registered or certified to act as a psychologist. No, I'm just using my experience over the 9 years I've lived with cancer to also help people. So occasionally, I have people come to me or I go to their places and I offer therapy for them. Yeah, so those are the ways that I use. I also use, particularly very interesting. I use my music and art to help people cope with their daily lives.
Now,
Yeah.
you've talked about cancer. I think I'll find time then we talk more about cancer because cancer is also a killer disease.
Yes.
Now, have you ever been depressed, Ama? Have you ever been into depression?
Yes, I was clinically depressed in 2012. That was my second year after getting diagnosed with cancer. So when it happened, it did happen instantly. I got into a coma that lasted for almost 3 months. And when I woke up, the process of recovery was very difficult for me. So that is the time I was depressed. That is the time I was clinically depressed. Yeah, it's not me saying that I was depressed. No, I was clinically depressed. I went for therapy and they gave me meds which I did not take because I have personal discretion for them. Yeah, so that was in 2012.
So how did you manage to tackle it after being out of hospital?
Well, it was a mandatory part of my recovery plan. Okay, so that means, and also that time I was admitted in the hospital, and it meant the therapy coming to talk to me and it would guide me through the recovery process. That helped me a lot. But when I went out, I thought it wise. Personally, it's not something I would advise for every other person. I thought it wise to just use what I am gifted with, mostly my art and writing and my resilience to cope with it. And I think so far I did manage well. I used art, I used writing, I used nature, I used to go for walks and just experiencing the environment and nature. And yeah, that brought me where I am today.
Maybe Omondiron, do you have any question to your brother?
So maybe unaweza ambia wase ni nini inaweza saidia msee ku recover from bipolar. I think some of the things pia ulikuwa unaweza ni advice as a brother.
Yeah.
If you do this mazee unaweza recover. So maybe
Yeah.
your word on it.
First, I think it important sana inakuwaga, let's say, acceptance. Huh?
Yeah.
Be very honest about how you feel.
Yeah.
But we realize that this is very difficult because one, mental health is still stigmatized in society.
Yeah.
Even within our families, people would not readily talk about mental health. Like if you say mtu akona depression,
Yeah.
anataka kuwa they call it a mad person. You
Yeah,
see
yeah,
that?
yeah.
So one thing is, and then another thing is, getting therapy is very, very expensive. Most therapists offer between 3,000 to 6,000 a session. You can imagine how difficult it is. And then the other thing is, diagnosing mental health. Mental health is just an umbrella body, but it has a lot of several things: bipolar, depression, schizophrenia, a lot of diseases. They're also very hard to diagnose. Sometimes there is what is called misdiagnosis. Unaweza kuwa misdiagnosed for schizophrenia and yet you have BPD.
Yeah.
You get the point. You might be having a mania and yet it's just a normal panic attack. You get the point.
Yeah.
So I think also one you accept the fact that you are struggling,
Uh-huh.
and then another thing, you accept the fact that you're powerless and helpless about how you feel. It's
Okay.
just like alcoholism.
Yeah.
Many people, when they talk about alcoholism, you accept the fact that I have a problem. Okay.
Mhm.
Two, you accept the fact that I am powerless and helpless about how I feel. And then that is the next point that comes in: therapy. Can you be able to offer therapy? There are several ways of offering therapy. You can go to a clinical psychologist if you have the money. I think there are so many NGOs and government hospitals that are offering therapy at subsidized cost. Or, all right,
I'll find time then we talk more about depression and cancer at large.
all right, all right.
But in the meantime, thank you so much
So,
for kuchangia kwenye topic ya leo.
nashukuru.
Asante sana sana sana.
Good afternoon.
Yes, huyu amekuwa ni Ochuka, a brother to Omondi Oronyi.
Yeah.
How do you feel talking to your brother kwanza?
It's strange because we always have this normal conversation kati ya mi na maybe about mental health, about life. So I feel that strange because wakati nilikuwa naanza kuongea nilisema wakati niko depressed is the first person